Hello, everyone. Welcome to the Colorado Coalition for the Homeless Education Series 2025. For today, our August session, we are doing it at noon again, so welcome. Hopefully, you'll enjoy this lunch and learn, and folks can go ahead, eat your lunch, and learn a little something today about federal actions. This is a session that we hadn't originally planned, of course. We didn't know what was going to happen. And so we decided to add this one in the last couple of weeks. If you could just go to the next slide, thank you. We did this presentation, a version of this presentation for staff, because people are really wondering what's going on with federal actions and how it's impacting the homelessness sector, healthcare sector, housing sector, all the parts that CCH touches, and many, many other orgs are impacted by this as well. But we're really looking at this through the lens of how it's impacting the homelessness sector, including housing and healthcare. So that's what we're doing today. Unlike many of our presentations, this one is going to be more of a presentation and less of a panel. So it really is going to be going through slides, telling you what we've learned over the last few weeks, and of course, the months of planning that went into the One Big Bill. And so this is sort of an opportunity to listen and learn about that. All right. So as I said, what we're going to be covering today is the overview of the new executive orders on homelessness and the takeover of DC. So two executive orders, the HR1 passage that happened in July, including toplines, sort of what happened and what didn't happen, and then what's the timeline for changes, and then a bit of a look forward as much as we know on what's next for federal and state activity. So with that, I will introduce Kathy Alderman, who's our Chief Communications and Public Policy Officer for the Coalition. If you could just go to the next slide. Thank you. This is a reminder to thank our amazing team that helps all this happen. So the whole education and advocacy team behind the scenes, clicking the buttons, getting everything going. So thank you for getting the slides going. So Kathy is going to be doing the presentation, and then Lisa Thompson, our Chief Program Officer, and Andrew Grimm, our Chief Integrated Health Operations Officer, will join for the Q&A if you have any deep dive questions that they're more able to answer about sort of the day-to-day of the coalition's work and the bigger picture of the impacts as they happen to our organization. So I'll hand it off to Kathy. Thanks.
Thanks, Alexis. And let me please echo what Alexis said with a huge thanks to the education and advocacy team for helping pull this webinar together, pulling the slides together, getting us all on this call. And thanks to my colleagues, Lisa and Andy, for joining me today. So I think we're going to start with the executive order entitled Ending Crime and Disorder on American Streets. This is the Trump administration's approach, or I guess plan, to address homelessness across the country. So next slide. There are 5 sections to the executive order, first being the purpose and policy. The second is entitled Restoring Civil Commitment. The third is Fighting Vagrancy on America's Streets. The fourth is redirecting federal resources toward effective methods of addressing homelessness. And the fifth is increasing accountability and safety in America's homelessness programs. We are going to share this resource with you. The National Healthcare for the Homeless has put together a good summary of the executive order. We're also going to walk through it right now. But I do want to say, for anybody who finds this executive order to be troubling, and we do in fact find it very troubling, the language on these slides is taken directly from the executive order. So it's not the Colorado Coalitions for the Homeless interpretation of the language, but it is the language itself. And we're just going to highlight where we think this could be problematic for folks living on the streets and for those service providers that are trying to provide services to our unhoused community. Next slide. So the overall overview of the executive order is it's really a broad approach to the federal government's ideas and, I would say, approach to addressing homelessness. It's really directed at the Housing and Urban Development Division, Health and Human Services, and the Department of Justice through the Attorney General's office. It essentially encourages states to criminalize homelessness by sweeping encampments and to prosecute any public drug use. It seeks to expand institutionalization of people that are unhoused, particularly those suffering from substance use disorders or mental health disorders, through the use of involuntary civil commitments. And it directs the government to end support for harm reduction and housing first approaches to care. Next slide. So that first section is restoring civil commitment. Again, this directs the AG's office and the Secretary of HHS to seek reversals of judicial precedent or consent decrees that limited the use of involuntary civil commitment. And essentially, it is encouraging the use of involuntary civil commitment for those living on the streets who cannot care for themselves. And the reason that's bolded in both of these sections is because it's not clear who gets to make the determination about who cannot care for themselves on the streets. We included the Colorado revised statute here for involuntary civil commitments. And in these instances, someone must be a danger to them, to others or themselves. And this is as determined by a healthcare provider. Unfortunately, because this executive order is very enforcement heavy, police enforcement heavy, we're concerned that a police officer or frankly, even a neighbor could call up somebody and say, I believe there's an unhoused person here that cannot care for themselves. Will you come and take them somewhere? And while we absolutely recognize that there are instances where people are suffering from mental health struggles or a substance use crisis on the streets and do need help, they need to be taken to safe places where they can be cared for. And this executive order does not go as far as to provide those safe locations or those recovery locations for individuals. And so our concern is that these individuals will be taken to jail. Next slide. This third section, entitled Fighting Vagrancy on America's Streets, is really directing these federal agencies to prioritize grants for the enforcement of camping bans, loitering bans, all of those laws that do criminalize and penalize somebody simply for their unhoused status. And we find that to be very troubling. We think that that could be a significant violation of civil rights. And in many instances, states have declared this to be a violation of civil rights. Unfortunately, what we saw several months ago with the Supreme Court's ruling in the Grants Pass decision is that local governments are allowed to enforce these camping bans even when they don't have services available for those people that they are moving along. Again, we don't think this is an effective solution to homelessness. It has never proven to be an effective solution to homelessness without those supportive services and housing on the other side of these enforcement actions. And again, we think that this could just lead to more criminal convictions against people experiencing homelessness, which actually just makes that experience worse and makes it harder for them to get into housing, to get employed, to get the healthcare that they need down the road. It also directs some federal funds for encampment removals. And so that's what we are seeing in Washington, D.C. right now, is the use of federal resources to remove encampments from public spaces. We highlighted this last bullet point on this section about establishing housing release plans from federal facilities. This is something that we've actually been advocating for years, is that when people are exiting jails, prisons, mental health institutions, or any other institutions, that there's a housing plan in place for those individuals so that they're not released into homelessness. So we think this is maybe a move in the right direction, but of course, implementation will be the critical part of how this plays out. Section 4 redirects federal resources towards effective methods of addressing homelessness. I think this is really troubling in several ways because it does eliminate funding for harm reduction programs, which we know to be highly effective in getting somebody on a path to recovery from a substance use disorder. It also provides some resources and technical assistance to move people into private housing and off public programs. Those terms are not defined in the executive order, so it's very unclear whether this is the public programs are just limited to housing programs or if it's both healthcare and housing programs. And it's also unclear what that private housing actually is and whether it's available for folks. There's another provision that ensures federally qualified health centers and community behavioral health centers reduce rather than promote homelessness. Again, these terms aren't really well defined, and so it's not clear what what that actually means, I would argue that FQHCs and behavioral health centers are not in the business of promoting homelessness, and in fact are doing a lot to reduce and resolve homelessness for individuals. And so it's unclear what this might mean in terms of funding and program support moving forward. But it does encourage the use of crisis intervention services, which is something that the Colorado Coalition for the Homeless strongly supports and that we deploy both out on the streets and in our housing and healthcare facilities. And so if there is available funding for crisis intervention services to address these issues on the street, we think that that could be beneficial. It also directs the AG's office to prioritize funding for drug courts and mental health courts, which again, these are highly effective programs for keeping people out of jails and prisons. But it's unclear how this administration intends to set these up and what the outcomes will actually be for the people who use these courts when they are facing these potential drug charges or charges about their mental health. The last section is increasing accountability and safety in America's homelessness programs. And it directs the secretaries of HHS and HUD to require more accountability in contracts and prioritize funding by ending support for Housing First programs, by increasing competition, by broadening the applicant pool for those programs that are eligible for funding, and holding grantees to higher standards for reducing homelessness and increasing public safety. I think we find this very troubling because we know that Housing First works. However, Housing First is starting to get a little bit of a bad name because people are assuming that it is housing only, and it certainly is not. Housing First has always been housing with supportive services, which I think is a really critical component of how we talk about Housing First, is that it's those critical services that help people stay stably housed once they are in housing, that really help people on the path to recovery. Housing First programs have been proven to be effective as much as 90% of the time, whereas these treatment first and work first models that would increase the applicant pool for other programs are largely only effective about 30% of the time. It's not to say that we shouldn't have treatment first or work first programs when that's the right intervention for an individual who might need that type of intervention. But what we are troubled by is that this might prioritize those less effective programs over the highly effective programs. It also requires that people who are participating in federal housing programs to participate in substance use treatment services and mental health services, maybe even if they don't need those services, which we think is not a good use of resources, nor is that an individualized care plan that would be effective for that individual if they don't need those services. And then in terms of safe consumption sites, it directs the AG's office to look at bringing civil or criminal actions against states or local governments that have such sites, terminate or freeze funds for any of those sites, and to require recipients of homelessness funding to collect health-related data on participants in those programs and sharing that data with law enforcement. We find this to be highly troubling, likely violative of civil rights. We're very uncomfortable with the idea that personal health-related data would be shared with police officers or ICE officers who are not in the business of homelessness resolution. Next slide. So though all of the provisions of that executive order are being understood, we're waiting for federal agencies to issue potential guidance on them. And then soon thereafter, the administration released the executive order entitled Restoring Law and Order in the District of Columbia. This order is what we're seeing play out today in DC with the federal takeover of DC. And part of that federal takeover is the enforcement and the removal of homeless encampments. We are not sure where the individuals that have been moved through this order have gone. We are learning more and more about this from our partners who are located in DC and witnessing this on the ground. There is an article by Invisible People linked here at the bottom of the slide deck, and something that we'll share with you that does talk about some of the people being moved, and the fact that many encampments right now are just, they're being broken up and those individuals are going and finding another place. If people have existing arrest warrants, they are being taken to jail, but we don't have a lot of information on how that's being enforced. But we do know that this executive order, in addition to some other things, is really intended to remove unhoused people from the view of this administration in the DC area. The president even tweeted, or I guess X'd out a message that said the homeless have to move out immediately. We'll give you a place to stay, but far from the capital. And we obviously find this highly troubling and concerning, and are looking to our DC partners to see how we can support their work on the ground. I think we're going to pause here to see if there are any questions on the executive orders. My colleague Lisa Thompson is here. Lisa is a clinical nurse psychiatrist, so does work in the space of helping people access the mental health services and the substance use services that they need to get on a path to recovery. And so could answer some questions specifically about that if anyone has them. So I will pause and see what my team tells me we need to answer. So I do see a question. Is there anything that Colorado citizens can do to combat these executive orders? I would say yes, we will hopefully be providing some guidance pretty soon about how individuals on the streets can exercise their rights if they're faced with the potential of involuntary civil commitment, and it's not necessary. I think we also, want to encourage our local governments and our state government, not to move forward with more draconian criminalization approaches to homelessness, but instead continue to embrace housing with supportive services, effective outreach strategies that are, person-centered, trauma-informed. And I think we'll continue to try to educate the public about why the programs that we have in place today are the right programs for the unhoused population, but that we really need to bring them up to scale to the problem that we're seeing today. So stay tuned on that. We'll be sharing resources as they become available.
Kathy, I'll just add in, we have a question from Randall about sort of any projection on this type of thing that happened in DC happening here in Denver, and if there's any strategies in the community to kind of protect us if it does move into Denver.
Yeah, so it's a great question. I will say that the administration has talked about federalizing police actions in other cities. Denver has not been on that list yet, but we do know that Denver is a targeted city for many administrative actions based on the current federal government's belief that the state itself, the Colorado and specifically Denver, are sanctuary cities. So I wouldn't be surprised to see Denver get on that list. But right now, there are efforts, I think, to look at Chicago, Boston, San Francisco. We know that the president sent National Guard to Los Angeles. I think we're gonna, our governors are gonna have to remain strong and stand up against these actions so that all of our cities don't become cities ruled by the federal government.
At first glance, it's looking like some of Randall's other questions might be more appropriate for the end after we cover the big bill. But Lisa, I saw you were coming off of video, so I didn't know if you wanted to add anything to this section.
No, I was just actually addressing some of Randall's questions as well, but I know that those are going to be addressed, I think, a little bit later in the big bill, but around the funding streams and how they could impact people who are currently in housing. I think, Kathy, you're going to get to that part in terms of the funding streams.
Yes.
Okay. There's another question about Housing First having been having bipartisan support for over a decade, and how are other Republican elected officials feeling or responding, voting to some of the comments coming out on Housing First?
Yeah, I think we haven't really tested how much damage has been done to Housing First through the efforts of organizations like the Cicero Institute and some other, conservative think tanks that are really casting doubt on Housing First and claiming that If Housing First was as effective as we know it to be, then why is homelessness increasing? And the fact of the matter is, homelessness is increasing because we are not making the investments in housing that people, especially people at lower incomes, need in order to exit the cycle of homelessness. And without that housing on the other side, we don't have a safety net to catch people when they fall into homelessness. And so I think we need to again talk more about housing with supportive services, which is born of the Housing First philosophy, is the key program that will be the most effective intervention for people experiencing homelessness. But the funding for both the housing and the supportive services is a critical component of that. And the federal government just hasn't made that investment in order to address the problem to scale. Um, Frankly, I'm not hearing a lot from individual members of Congress about these approaches. But I do think that as HUD moves forward with its guidance on implementing this executive order, we will start to hear members of Congress voicing their understanding and or views about these programs. So again, I know it's not very satisfying, but stay tuned for that too.
Um,
All right.
Sorry, before you move on, Kathy, there is one more in the chat. Although we're trying to get them into the Q&A in the future, folks can please use the Q&A feature. I did want to ask this question from Leslie. Is CCH accepting new patients for mental and or physical health? There had been a period where you hadn't been, and then just wanted to know, this person was fortunate enough to get services, but other people haven't been able to, and so wanted to understand how that's working specifically at CCH.
My understanding is the answer is yes, but I'm going to look to my colleagues who are on the ground in our health services space.
Andy, do you want to take that one?
Sure, I'm happy to take that. So just to clarify, the only location where we put any type of waiting list or other restriction on new patient access was at our Stout Street Health Center location, and that was for primary care and dental services. We've always had open access to behavioral health services, including psychiatry, that folks can continue to walk in and present as new patients for. We have introduced a new process on Wednesday mornings for a coordinated intake process with our outreach and engagement services for folks to establish as new patients at Stout Street for physical health and dental. I will also add that folks can continue to walk in and access services at our 48th Avenue Health Center location, at our West End Health Center location, and at our Fort Lyons site. Those are still fully available for new patients, and we're currently evaluating our capacity at Stout Street to determine whether we'll be able to soon open up access for new patients yet again.
Thanks, Andy. I think we'll move on to HR1. I know that Lisa will likely have to jump off, so you'll just have Andy and myself at the end here for questions. But let's go ahead and jump right on into the federal bill. So as many of you have heard, this bill passed and was signed into law on July 4th. And overall, it extends the 2017 tax cuts through pretty massive spending cuts over the next 10 years. It expands the Department of Homeland Security and Immigration and Customs Enforcement by $45 billion, which is the largest expansion of those divisions of our government that I've ever seen in my lifetime. It expands Department of Defense funding by $150 billion, which actually is not as unusual. We often see this in Republican-led administrations, higher investments into defense funding. But overall, it also increases the federal deficit by $2.5 to $3 trillion. And it does that on the back of some really important programs and for people experiencing homelessness, including Medicaid, which is health insurance coverage for lower income households, which will be cut by $930 billion over the next 10 years. There were some things that were proposed that weren't included in the bill that could have been pretty harmful, including the block granting of Medicaid and SNAP programs, which would have resulted in reduced spending in those programs for states. per capita caps for Medicaid enrollees, which would have limited how much Medicaid could actually cover for anyone's healthcare needs. There were some suggestions on reducing the federal matching payments to states for certain coverage programs that they had enacted themselves. There was also a prohibition on gender affirming care and a suggestion that we sell off public lands to pay for these tax cuts. All of those provisions were proposed but not included in the bill. Will we see them and standalone legislation moving forward? It's possible, and we'll be keeping you informed about that. Next slide. And so while we know that over the long term, this bill is going to be pretty harmful, there are some positive aspects of the bill that impact some of the areas that we care about, including housing, healthcare, some tax provisions that could help lower income households, and a rural health program. Next slide. So on the housing side, HR 1 did increase the credit allocation for the low-income housing tax credit, making more funds available for those equity investments in deeply affordable housing. It also decreased the amount of money that a housing provider or a housing developer like the Colorado Coalition for the Homeless has to bring to the table in order to use private activity bonds, which will make developing affordable housing hopefully easier in the long run. It also expanded the opportunity zone investments. This is tax benefits for individuals or organizations that make investments in certain areas. And by lowering the area median income requirement for those lower income communities, these dollars can then go into communities that might not have otherwise been served. And those communities with the very lowest AMIs or area median incomes are likely to see more investment, which could be a good thing in the long run. And it also expanded permanently the new market tax credit program. This is a really important program for investment in new community benefit services. So for instance, for any of you on the call today who are familiar with the Stout Street Health Center or the John Pervinsky Recuperative Care Center, those were both built with new market tax credits and low-income housing tax credits because they have a community benefit service, the healthcare, and housing on site. And that just gives organizations like the Colorado Coalition for the Homeless more opportunities to build out these types of services. Next slide. It also expands access to Medicaid home and community-based services by giving states the option to apply for some additional funding. I think this is something that obviously people that have certain healthcare needs to have someone come into their home and provide these services can be really a critical stabilizing factor in them being able to stay housed. What we do see is that these services are oftentimes needed in places where they can't be accessed, including sometimes in shelters or obviously for people who are living on the streets. But it is a new investment in these services at a level that we haven't seen in some time. It also provides temporary payment increases under the Medicare program for physicians participating in that program, which could potentially get other doctors and clinics involved in the Medicare program, providing more services to our seniors. But that could change because if Congress passes a bill that increases the deficit, they have to make corresponding spending cuts throughout the budget year. That is known as the pay-as-you-go bill or waiver. And if they don't pass a waiver from those requirements, then automatic Medicare physician fee decreases will begin year over year. So these increases could be offset by decreases if Congress fails to pass a pay-as-you-go waiver. The bill also created a rural health grant program with about $50 billion being made available to states that want to implement this. But because the rural healthcare system is estimated to lose $155 billion from the other provisions of the bill, this $50 billion might not actually be enough funding to keep our rural health systems afloat. Next slide. There are some tax provisions that could help low-income households who do file taxes, including child care tax credit and a child and dependent care tax credit, which were both increased by dollar amounts or percentages. There is a citizenship requirement and a Social Security requirement for both of these programs now. And so that could limit how many families are actually able to access these tax credits and reduce their tax liability. Next slide. Some of the other tax provisions, including doubling the standard deduction, which can also reduce tax liability, providing a tax deduction for taxes paid on overtime. So this is not actually a no tax on overtime, because your overtime will still be taxed, but at the end of the year, you can reduce your tax liability by some amount, which I think is a little confusing just in terms of how it's been talked about publicly. There's also an expanded deduction for seniors. You can deduct vehicle loan interest from your taxes if you have an American-made car. There's a new program going to be set up for child savings accounts, which could give parents the ability to set up savings accounts with up to a $5,000 annual investment. There is some concern that this is, and it has been spoken about publicly, as potentially being a backdoor into kind of dismantling the Social Security program. So if these investment accounts serve as somebody's retirement, then maybe Social Security could slowly be pulled back for households that have these investment accounts. And then just for individuals who do not itemize deductions, there's an automatic 1,000 charitable deduction, so reduces everybody's tax liability by about $1,000 if you file taxes. So we talked about the positive parts of the bill. Now we're going to move into the harmful effects of this bill, including the ones that took effect immediately. There was a prohibition on Medicaid payments for 1 year to nonprofit organizations that provide abortions and received at least $800,000 in federal funding. This is specifically targeted at Planned Parenthood across the country. It is currently being litigated and has been enjoined, so Planned Parenthood is able to see their Medicaid patients for primary care right now, but obviously it's going to have to work its way through the courts to see what the final result will be. There were restrictions for certain immigrant populations in accessing Medicare coverage. There were limits on provider taxes, which we'll talk about a little bit later, but this is a significant funding source for the state of Colorado for the expansion of its Medicaid program and other services. And so we'll have some pretty detrimental impacts. There's also a prohibition on and a rule that would have required minimum staffing standards for long-term care facilities, which obviously puts residents of those facilities at potential risk. There was the green retrofit program was rescinded, and we note that because this is one way in which affordable housing developers and providers can rehab or renovate their current buildings that might be a little bit older by making them more energy efficient. They can get some additional investment and funding, and this program was rescinded, which I think will be a real detriment to the affordable housing community. But most importantly, the corporate individual tax cuts that were extended and expanded have significant impacts on state budgets. And we'll talk a little bit about what that looks like in Colorado on future slides. So the big buckets where these kind of harmful provisions will have these rolling impacts include changes to Medicaid, the changes to provider taxes that I just mentioned, changes to the Supplemental Nutrition Assistance Program, also known as SNAP, and changes to how immigrants can access benefits. Next slide. So on the Medicaid side, because of the changes that have been made to the Medicaid program, which are largely been made through cost sharing requirements, work requirements, retroactive coverage limitations, enrollment changes, and matching payments. These will all increase administrative burdens significantly, and they will also likely result in people not re-enrolling in the benefits that they're eligible for or recertifying for those benefits. This is likely to have an $11 to $18 billion impact in Colorado in reduced Medicaid spending, and is likely to impact over between 95,000 and 207,000 people in the state. So these changes include giving states the option to require a cost sharing requirement, though federally qualified health centers have been exempted from that, but it could mean that people on Medicaid who are receiving services somewhere else, if the state were to implement a cost sharing requirement, would have to pay out of pocket. There are work requirements for Medicaid enrollees between the ages of 19 and 64. They must work 80 hours a month or be enrolled in an employment or education program. We expect CMS guidance by the middle of next year about how states are supposed to implement this, and it is likely going to keep people from being able to access the health insurance coverage that they would otherwise be eligible for. Next slide. There is a decrease in retroactive Medicaid coverage, which in Colorado is often referred to as presumptive eligibility. So that if somebody sees somebody who they believe is eligible for Medicaid, they could have provided services on site, and then the coverage would have covered somebody back 3 months. This limits that to 1 month. There are some enrollment changes that will make it a little bit harder for folks to stay on Medicaid because eligibility will check every 6 months instead of annually. And there's some limits on federal matching payments for the emergency Medicaid program, which is oftentimes the only health care coverage that folks on very low incomes can receive if they have a life or limb issue, is how we refer to it. So a life or death issue, something they need emergency services for. Next slide. So back to the provider taxes. So the provider taxes over time will be decreased from 6% to 3.5%. This is a way in which Colorado takes in money through a tax on hospital systems to pay for Medicaid expansion or pay their share of the Medicare expansion. And the state is currently estimating that it will result in a loss of between $900 million and $2.5 billion a year, which could significantly impact the state's ability to continue to administer the Medicaid program that we have today. Next slide. There's also some big changes to SNAP, including capping future increases through requiring the Thrifty Food Plan to be cost neutral, which is kind of the baseline for how healthy food programs are built off of. It increases the state administrative cost share from 50 to 75%, and it requires for the first time states to pay part of the SNAP benefit. This has always been a federally funded program, and now states will be required to pay between 5 and 15% of the actual benefit itself. This is likely to impact over $237,000 families in Colorado, with a cost to the state of about $250 million. There are also some work requirements now for SNAP that have been expanded, requiring more than 20 hours a week between the ages of 54 to 64. And there are restrictions on how immigrants can access the SNAP program, and there's an elimination of funding for the nutrition, education, and obesity program, which is really the program that provides SNAP eligible households with the nutritional information and the healthy meal information that they need to use their benefit effectively and in a healthy way. Next slide. Lots of restrictions on how immigrants can access benefits, including Medicaid, SNAP, the CHIP program, which is the Child Health Insurance Program, and the Obamacare or the ACA tax credits. This restricts access to these programs to refugees, people granted asylum, survivors of domestic violence and trafficking, and individuals with temporary and protected status, and some visa holders, which is going to be a significant portion of the population who are now going to be uninsured, likely driving up the cost to emergency systems because there is no longer going to be this coverage in place. Next slide. So on these next two slides, we do provide a full timeline of when each provision that we've talked about today will go into effect. I'm not going to read all of these out, but we will make this available for folks after the call so that you can see what we will be planning for over the next 3 years, essentially, in terms of when these changes will take an effect and what the impact will be on the people that we serve. Next slide. So what's next that we're kind of watching on this federal landscape? Congress is just returning to Washington, D.C. after their August recess. And their first order of business will be federal appropriations, including the Transportation, Housing, and Urban Development, or what we refer to as the THUD budget, which must be approved by October 1st. This is the budget that holds all the housing and homelessness funding. We know that the president proposed 44% cuts to HUD and the consolidation and/or elimination of critical homelessness programs. The House proposal was very similar to the president's budget. It included $939 billion in reductions, the elimination of the home program, which builds affordable housing, and a 2-year restriction on the use of benefits, including housing vouchers. The Senate proposal was much more reasonable. It passed at the end of July. It did increase most programs by about 6%, which still doesn't really catch up to cost of living and inflation costs, but it is obviously a much better deal than the House version, and it eliminated that 2-year restriction that I just mentioned. There's no funding for emergency housing vouchers, which about 60,000 households nationally are relying on today. There are 2 links in here, which we will share with you after the fact on a budget chart that compares the House, Senate, and President's versions of the budget, and a good overview if you'd like to do a deeper dive. When the House and Senate return, they're going to have to come to a conference and work on a compromise bill. So it's not likely that we'll see all of the potential pros of the Senate proposal because the House will certainly want concessions on some of the things that they propose. And so we'll keep folks updated as we learn more. Next slide. Through the federal appropriations process, we also are watching federal funding for federally qualified health centers, or FQHCs, and community, also known as community health centers, because that mandatory and discretionary funding expires at the end of September. There's 2 different processes for this funding. One is through a committee, the House Energy Commerce Committee, and the Senate Health, Education, Labor, Pensions Committee, sometimes referred to as the HELP Committee. Right now, there is stable funding at about $3.9 billion a year for federally qualified health centers. And we're not hearing that that's going to change, despite the fact, again, that cost of living increases have been significant, and we have enormous inflationary pressure on our lower income healthcare system. And then that discretionary funding is subject to this appropriations process, and it's currently funded through a continuing resolution at $1.7 billion a year. We did see a small increase in the Senate's version, but it's likely, we're hearing likely, that there's going to just be flat funding through a continued resolution to keep the government from shutting down on October 1st. So more information to come on that as well. What's happening at a state level? Many of you, if you're paying attention to the news, know that our General Assembly had to go into a special session on August 21st. They wrapped that business up last night, and the session was to address the $1.2 billion budget gap that the extension of these corporate and individual tax cuts are going to have on our state budget. So there were some corporate tax loopholes that were closed during session, and then there will be some subsequent cuts made by the governor to specific programs to address this $1.2 billion budget gap. We'll see in regular session the continued response to how these cuts will impact the state budget moving forward, and how they will be implemented in terms of how they're going to impact the people that we serve through these programs. We also know that these could impact our legislative priorities, including the extension of the homelessness contribution tax credit and our efforts to increase homelessness infrastructure throughout the state. Next slide. And so that is it. We still do have time for questions. I'm going to ask my team to help me kind of sort through what questions have been put in chat and Q&A. And we also will be sharing this slide deck after the fact and the resources that have been put in chat and or linked to from the presentation.
Thanks, Kathy. One question we have from Tamara is, are there any specific lawsuits filed against these changes? Is CCH part of any specific efforts to counter these changes?
Okay, so on the executive orders, there are no lawsuits filed specifically on that first executive order because nothing has happened yet. So I think as soon as we hear from the federal agencies that they might be cutting funding to Housing First programs, that lawsuits will likely be filed, but that action has to happen before a lawsuit can be filed. HR 1 is now the law. So there are certain instances where some lawsuits could be filed. For instance, in the Planned Parenthood situation, you cannot target a specific provider for eligibility in the Medicaid program, and that is essentially what Congress has done. And so that violates other laws. But there are very likely not going to be a lot of lawsuits filed against the other provisions because Congress passed them and the president signed them. Now, in some instances, it is likely that states will be able to file some lawsuits about the impact of implementation or how they're being viewed in terms of what portion of the SNAP benefit they would have to pay. And so I do think that there will be some litigation on certain parts, but not obviously against the whole thing. I think, will be looking to see specifically how these changes impact us. And if we do think that any of that has been violative of any other laws, we will certainly engage legal counsel as we can.
Thanks, Kathy. One question from Randall is about, he has a question about general impact fund streams for the care and housing of homeless people, but I think you may have somewhat answered that as well as we can at this point. But he specifically asked, will people who are housed right now be at risk of losing their housing if these funds are cut and they have no income stream?
It's a great question. So it is not likely there's going to be any funding from HUD for emergency housing vouchers, which was a housing voucher program stood up during the COVID crisis and has moved many people out of the cycle of homelessness and into housing. In Colorado, we've kind of known this was going to happen, and so we've been slowly trying to move people off of those housing vouchers into other housing voucher programs. If there are significant reductions in HUD funding, we could see certain households losing access to housing vouchers, or those vouchers not carrying the value that they carried previously in terms of how much they could pay towards rent. We just won't know until the HUD budget is finalized and states are notified about the funding availability to them.
Thanks, Kathy. And Whitney similarly asked, can you talk about cuts to HUD impacting CDBG and CSBG programs? Is that essentially already the same? We just have to wait and see what happens?
We do have to wait and see. What we do know is that the president and the House suggested eliminating these community development block grant programs, which are really critical for the building of affordable housing and other services in communities. The Senate's version of the bill kept these programs in place and did have some funding increases. And so what's going to be important now, and we'll ask all of you to join us in really pushing the House and the Senate to come to a compromise that keeps these programs intact.
Right. This one may be a little in the weeds from Janet. We have, do we anticipate the work requirements will follow similar case management verifications of other work programs like monthly TANF reporting or work participation rates?
Yeah, I think that the hope is that when the federal government releases its guidance on this work requirements, that it will provide pathways for states and local governments to use current systems to do this confirmation. So just as you mentioned, because otherwise we would have to set up, different systems for every different potential benefit that is all going to be requesting the same information. I think that states have a real vested interest in trying to implement these requirements as efficient as possible.
Cassie asks, will having a disability still waive the work requirements for SNAP?
I think that the hope is yes. And again, we're going to have to wait for the federal government to actually provide what those exemptions could be, what kinds of disabilities might qualify, whether there's going to be any restrictions on that. But I think that we will see some protections and exemptions for certain populations and the guidance and the implementation process.
Thanks, Kathy. We're really firing a lot at you, so thanks for answering so succinctly. Sarah had a question about COC cuts. Do we have knowledge on that just yet?
Yeah, so again, there was the president's budget, and the House did suggest a consolidation of all homelessness programs, so the ESG and COC funds being consolidated and potentially shared with states through a block grant process. The Senate did not require that, so now we have to wait to see how the House and Senate reconcile those. I would say, again, as encouraging as it is to see that the Senate bill had some increases to these programs, because the House had so many draconian cuts, it is very likely that we will see flat funding.
Thank you. We have another question about data. So, just as I think this is probably more in relation to the executive order, how do we protect the data of folks who feel they have want to come in for services but are worried about, data being safe from any sort of changes that are happening at the federal level?
It's a great question and something I think that we feel very concerned about. Um, To be clear, that data is not being collected today and it is not being shared with any law enforcement today. I would fully expect lawsuits to be filed upon any attempt to implement those provisions, because there is no reason why law enforcement needs your access to your health related data. And we will be as involved as we can through the Attorney General's office and other ways to make sure that people's personal health identifying data remains protected and private.
Thanks, Kathy. Yeah, Andy, I was just going to ask you to pop on because we're getting a couple questions that feel like they're about like next steps, what can we do? And so before we get into those, I wanted to see, Andy, if you had anything to add to the conversation specifically in the healthcare realm.
No, I don't think so. Kathy has been doing an incredible job fielding the multi rapid fire questions. But if there are specific healthcare related questions, happy to try and answer those.
Great. Well, I'll sort of start to move into these other questions and we can always take a step back. This is planned to go till 1:15, but like I said, we're moving quick, so may end a bit early. And we know many people do drop off at 1 when we hit that hour mark as they have other meetings to head to. Um, Mandy left a comment that this all feels unprecedented and there have been such drastic shifts in funding and policy. What can we do to prepare for the October 1st vote? And sort of what can we do with people who are already struggling so much before these changes are being implemented?
Yeah, it's a great comment and question. I think we're all feeling the same. This is a significant shakeup and restructuring of benefit programs that we know are life-saving. And it's very concerning, and we want to do everything we can to make sure that people who are eligible for the benefits that they are eligible for today maintain access to those benefits. So one thing that we're telling our teams is, to the extent that anybody might be behind on some paperwork or might need to get some additional information in, that they do that now, so that they can maintain coverage moving forward, and getting into the habit of keeping that information fresh, so that if this recertification every 6 months becomes effective, that folks are ready to provide the information and the paperwork that might be necessary for those recertifications and verifications. Another thing that I will mention is we have been asking you as our advocacy community to do a lot of outreach to Congress, a lot of outreach to the administration, a lot of storytelling, and we're just going to have to ask even more. Over the next month, we're going to be asking you to reach out to our Senate offices and our House offices quite a bit to make sure that we get the very best HUD budget that we can for our housing and homelessness programs. Same thing on the community health center, federally qualified health center side. Flat funding is not going to be sustainable in the long term for these healthcare services for these particular households who depend on these entities for their healthcare. Because again, we're just seeing enormous pressure on health centers already because of inflation, wage costs. Everything is getting more expensive, and the money available is just simply not keeping up. I would also just say, that as a community, we just have to support each other. We have to recognize that people are going to be really stressed out by these changes. And so what can we do to make sure that, we are both advocating and with the loudest voice possible, telling our stories, but providing as much support as possible to each other while these changes take effect, because they are going to really change people's lives.
Thanks, Kathy. And we do have a question from Andy that says, if I were to call my representative, which topic should I focus on efforts getting behind them? I'll just go ahead and answer that we are working organizationally to send in our homelessness in the news every Thursday. If you're signed up for our email list, you'll see every time and ask each week to ask you just one thing to concentrate on that week. We know that this is overwhelming. It's overwhelming for people receiving services. It's overwhelming for those of us who work for the sector, and it's overwhelming for all community members. And so really what we're trying to do is just give you one action item each month to concentrate on. So please do join our email list for that. And if you join our advocacy network, you're not only going to get those Thursday homelessness in the news, you're also going to be, when it comes time to do lobby day in person, or when there's things happening at the local level, you're going to get each and every alert, and it's going to ask you to take an action. So that is one thing we ask you to do, and that's sort of high level. And then I'll ask Gabriella now to share screen again, and we can talk a little bit about the other ways that folks can help. Basically, for next month, our plan is to do almost the same but the opposite of this presentation, which is what can you do to help, but what can you do in your own backyard? What can you do in your neighborhood? What are people already doing that's successful? And so we recently have put up on our website a community action page, a community education page. So we're hosting all of these sessions if you want to deep dive on a topic. We have very simple community actions that folks can do in their neighborhoods, one-on-one, to each other, for each other. And so we really wanted to just have a spotlight for that next month. If you were on this call, when we send you the email that'll have the slides and the questions, and this recording, we're also going to ask you, hey, what do you want to learn about in that session? We're still putting it together. It's going to be in about a month towards the end of September. So please help us with that. This is a two-way conversation, and we want to make sure that while we're asking you to do these big things like contact your senators and change structural issues, what can we do day to day, person to person? So yeah, I think that wraps it up for today. If you have follow-up questions, you can always email us back. You can email advocacy@coloradocoalition.org, or most of our emails are available online as well, Kathy or myself, and we can get back to you. But thank you. We had about 100 people on this today, so thank you so much for taking the time. This is a choice to come and learn this. If you found it valuable, please share it, and we'll see you in September.
Thanks, everyone.